Bismillah ar-Rahman ar-Rahim. Assalamu alaikum and good afternoon, participants. Thank you for joining the session. As Rehan has shared that the today's topic of training is importance of key performance indicators in improving pharmacy services. In the start of the presentation, just have a look on the learning objectives of the presentations. At the end of the presentation, you all would be able to identify the concept of key performance indicators, apprise the benefits and advantages of KPIs, formulate goals and measures their implementation by using KPIs, understand the common examples of KPIs, and apprehend KPIs in pharmacy practice. So, first of all, uh, any problem, yes, I can solve it because I am KPI. In our daily routine and in our daily practices, we use encounter very problems in any field. So, by using implementation of KPIs, we can solve most of our problems by continuously monitoring them and measuring their data, and upon the data, taking good decisions and training of staff. So, in any case, KPI is a very good tool for improving our problem and solving our problems. Now, first of all, key performance indicators, critical indicators of progress toward intended results. It means that they are basically the indicators which are showing the progress toward an intended result, means what we want to do and what we have targeted as our goal and objective, and what is our progress toward our intended goal or objective. It provides a focus for strategic and operational improvement, create analytical basis for decision making, help focus attention on what matters most. Yes, this is the most important point, that we have to be very cautious and very objective towards our goal and our important items, like what matters the most, like it's written here, and it objectify or it diverts our core attention towards the goal or objective. As a Peter Drucker famously said, what gets measured gets done. So KPI should be measurable and it should be attainable. Like we have seen that in the KPIs, that they should be objective, they should be measured, and it can be optimized. There should be a strategy, there should be a comprehensive strategy. Performance can be measured. There are a number of key performance indicators and their evaluations. Now, what are the good KPIs? As you have seen this mnemonic, SMART, as the word is saying itself, that SMART, the KPI should be very, very smart, so that we can achieve our goal and our objective very precisely. S stands for specific. The goal should be, our KPI should be very, 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 very specific. For example, who, what, why, where, then, when. Then we should be very specific about then. If we are identifying any goal and identifying any key performance indicator, then we should be very clear about it, that who will perform or who will be participating in this KPI, and what will be done in the whole process, why we are doing this, and where it should be implemented, and when we will do this. Next one is M. M is measurable. This should be measurable, as we have previously read that if something is not measurable, it's not done, and it's a very common saying in patient safety and medication safety, that if something is not documented, it's not done. So it's very important for our tasks, our goals, our KPIs, that it should be measurable. How much, how often, and how many. It should be attainable. We should not identify or set such targets which are not achievable and which are not clearly related to our goals. Next one is, it's relevant. It's particularly relevant to our problem, our goal, or our objective, so that we can we should be very, very, very precise about our KPI. It should be time based. It's a very important part, that we should be time bound. If we have not kept our time in case of any scenario and any KPI, key performance indicator, then it's very difficult to monitor the performance and to get the desired improvement or focused growth, because time is the thing which can manage the KPIs very excellently. In general, SMART means the specific, measurable, attainable, relevant, and time based. So our KPIs should be very smart. So what are the importance of KPIs? These are some benefits of using KPIs. By using KPIs, we can improve the accountability of our staff. We can improve the focus. Yes, because we have the KPIs improve the focus, because we are moving around a very precise or very specific objective. It improves the clarity among the staff, among the goals, and among the processes we are doing. It improves relevancy. Yes, we have studied that the KPI should be very relevant to the topic or very relevant to the goal. So if it's very KPI is very relevant, then we are doing a very relevant job, and definitely it will we will get the relevant results or improved results. By using these, we can get a better decision making. Yes, definitely, because if we are doing a very specific job, specific key performance indicator, and we are moving in a right direction, and we are getting a true measures which are we getting. So on the basis of true measures or true statistics, we are in a position to have a better decisions upon our problems or our targeted objectives. It reduces waste. Yeah, definitely, because if we are very focused about our work, we are very clear about our work, we are very relevant to our work, then it definitely reduces the waste in our processes. And by reducing the waste, we can enhance the efficiency of the work. It increased visibility, it increased faster growth, better performance, and ultimately higher returns. And in case of healthcare sector, or patient safety and medication safety is very important. So patient satisfaction and achievement of desired patient outcomes and results are the true returns in case of healthcare sector. Move towards the types and categories of KPIs. There are many types and categories of KPIs. Some of them are there are some KPIs which should be process related, some are input related, some are output, leading outcome, qualitative and quantitative. It means that we can incorporate or inculcate KPIs in every process or at every step of our process. So these are the categories of KPIs. There are some measures of KPIs. Number one is strategic measure. The strategic measures include the track and evaluate of organization process. Yes, because organizations or departments are mostly moving around their strategic goals and objectives. Track and evaluate organization process. Focus on intended and desired results. And operational measures are focused on operations and tactics designed to inform better decisions. Project measures include focused on project progress and effectiveness. Risk measures include focus on the risk factors, threats to our success. Employee measures include focused on human behavior, skills, or performance needed to execute a strategy. So these are some measures of KPIs, like by which means we can measure our KPIs, and what measures we can evaluate our KPIs. So these should be a strategic measure. There should be could be operational measures, project measures, risk-based measures, and employee measures. There are some examples of operational measurement, like inputs. FTEs and budgets are the inputs. Process includes efficiency, output, input, cycle time, cost per unit, outputs, and likewise strategic impact measurements are like intermediate outcomes and some end outcomes. strategic business intelligence increase. So these are some examples of operational and strategic impact measures. Now moving towards the core of our today's topic, that is impact of KPIs in improving pharmacy practice. So let's study that how KPIs are linked to pharmacy practice and how KPIs can improve pharmacy practice, and why we should use KPIs in improving our pharmacy practice. Pharmacy deals with both service and product. Yes, definitely, because patient and customer care are our service and therapeutic goods, our product, has a direct link with patient's health and life. When there is a patient health, the process should be very, very uh, clean and clear and error-free. So patient health and life is very important. We have a direct link with organization repute, direct link with budget and revenue, and regulatory compliance are always there to comply. There are some operational and clinical core function must be monitored and achieve result. So by viewing all this, we can say that the KPIs are very important in improving pharmacy practice, because we are directly linked with the patient's health, we are directly linked with organization repute, and regulatory compliance is a very key important measure in running the routine operations of pharmacy. Pharmacy most of the times comes the top 5 revenue generating centers of the organization. So it is very important for pharmacy practice to improve on regular basis, and for that KPIs plays a very important role. So we will study in the coming slides that how KPIs are playing their role in improving pharmacy practice. Importance of KPIs in pharmacy practice: to identify pharmacy core function, to continuously improve them, to keep the pharmacy workforce accountable and on track. Goals of developing and maintaining KPIs. So these are some common goals of developing and maintaining KPIs: to standardize, advance, and benchmark internally and externally pharmacy practice. Yes, by developing KPIs we can standardize our practices to on the basis of what is happening in the global world, what are the new researches, what are the new advancements in the pharmacy practice. So we can by setting the goal, by setting the benchmark, we can improve and bring advancement in our pharmacy practice, and we can standardize our practices according to the international best practices globally. To comply with the best practices of patient and medication safety, to improve the current practices in pharmacy, to cope with the key challenges faced by the pharmacy. So these are some goals of developing and maintaining KPIs, for which it's very vital for us to set some KPIs, to work on the KPIs, to take best decision on the basis of KPIs, to improve staff, and ultimately improving patient satisfaction and improving the error-free medication management services to the patients. By developing comparison strategies, and we can share and learn best practices and advance the profession. Examples of pharmacy core functions. These are some core functions of pharmacy practice and pharmacy department. And by seeing this, we can clearly understand that these are the core and very important functions of pharmacy practice. Just like inventory management is the we can say that it's a backbone of pharmacy practice. There should be minimum variations and turnovers in inventory, and by setting our clear KPIs and goals, we can streamline our inventory process or inventory line. Prescription review, pharmacist intervention or pharmacy formulary compliance, customer satisfaction, timely delivery of medicines. It's very important in pharmacy practice that we are there for the patients, and it's very important that the desired medication should reach to patient or dispense to patient in a very timely manner. So timely delivery of medicine is a very good process, and it should be clearly monitored and clearly defined. Revenue and sales, correct and error-free dispensing, regulatory compliance, TRAP rules, etc. So these are some examples of pharmacy core functions, and these all are very, very vital for for pharmacy practice or pharmacy department. So we should always strive for improving and making our process error free for the best medication practices in the pharmacy. There are some factors which should be considered while developing KPIs. Like KPIs are not very easy to develop KPIs, and likewise not very difficult to develop KPIs. We just have to focus on some key points, and we would be very clear that how our KPI would be doing. Just like we should be very objective on, not based on opinion. Yes, just like we cannot based on our opinion, like this should be improved, or this ABC services should be improved, or we have inventory should be increased. So we should be very objective about our goal, like our objective is to dispense medication in a defined time frame. Yes, this is very objective, that we are very focused that we need to improve time frame. Next one, be derived from strategy and focus on improvement. These should not be some vague working behind it. It should be derived from some strategy or some strategic measures. Be clearly defined and simple to understand. It should be very simple to understand and clearly defined. It's very important, because KPIs or our routine processes are being done by our frontline pharmacists or frontline staff. So frontline staff should be very clear about the process, and it should be very simple for to understand for our frontline staff, because if they understand the things properly, they would be more feasible and more good in implementing those KPIs. It should be very relevant with an explicit purpose. Be consistent in that they maintain their significance as time goes by. Yes, because it should be consistent, and the significance of KPI should be maintained. It should not lose its significance, or staff should be continuously vigilant about these. So this should be very consistent. Be specific and relate to specific goals and target. Be precise, be exact about what is being measured. If we are not precise and we are not clear about what we want to measure, then it would be very difficult for staff, and it would be difficult for the quality and patient safety department to measure what are the true measures which we wanted to achieve. Then provide timely and accurately feedback, because feedback is very important in this um, KPIs, because feedback, upon the basis of feedback, we would be knowing that how our key performance indicator is doing. Either we are achieving good results, or either we are achieving our desired measures or desired targets. So the feedback of is very important, and it should be very timely and accurate, because if it's not timely, then we have already shared that the KPIs and its related working, it should be very smart. It should be time bound. If the feedback is not timely, then it might be of no use when we get feedback. And it should be accurate. There should be no ups and downs in the feedback. It should be very accurate and crystal clear. So uh, as far as the accurate is the feedback, the it would be easy for higher management or top management to take good decisions upon these implementation of KPIs. It's a quick thing, that which one is precise, specific, and simple. What you think that well, among both statements, which would be more precise, specific, and simple? Number one is we will improve the pharmacy services, and secondly, we will improve the timely delivery of medicines within specific time frame to the admitted patient by 50%. Just have a look. Yes, it's very clear from its statement that the first statement is we will improve pharmacy services. Yes, it's a very generalized, or it's a very subjective statement that we will improve pharmacy services, and there are a lot of work and a lot of operations, different departments, sub departments of pharmacy practice. It's very important to define the clear objective. Unlike in the second statement, it's very clear that we will improve timely delivery of medicine. It means that we are focusing our turnaround time to the admitted patient by 50%. So it's very clear that statement number two is very precise, specific, and very simple. So which one is relevant? Improve the hospital formulary compliance up to 90% versus improve the timely administration of stat medicine doses up to 90%. Yes. Relevant to pharmacy, pharmacy practice or pharmacy department has a very or minimum role with administration of medication, instead of just monitoring the adverse drug events or adverse drug reactions. Pharmacy department is not doing administration, is just a nursing side to administer the medication. So up to 90% doses are administered to patients. Are it can be a KPI of nursing side, or it should be relevant to nursing side, but as far as pharmacy practice is concerned, improving the hospital formulary compliance up to 90% is more relevant to pharmacy department. Implementation of KPIs. There are some common steps of a perfect KPI or to implementing KPI. We just have a quick go through these points. That first of all is define KPI name, just what we want to do. Align KPI with strategic goal. That we should define such indicators as KPI which are directly related to our strategic goal or which have a greater impact on our strategic goals. Number three, define current value, baseline, or target. Yes, before defining KPI, it's very important to gather some data or some baseline data, like where we are standing right now and what we want to achieve after implementing KPI. For example, if we want to improve some service and we are currently at 40%, like we have done our baseline study and we found out that we are standing at 40%, and our target is to improve it to 90% in 1 year. So this would be a current value is the 40%. So we should be very clear about our baseline data. If we do not have any baseline data, we will not measure or gauge the growth or performance with our current practice and our improved practice. Data collection step. The data collection step should be defined, and from which step data should be collected, and where it should be analyzed, and how it would be measured and presented. Find leading and lagging indicators, define the weight, agree on updated frequency, set expiration date, calculate the cost of KPI tracking, define rights and roles, declare KPI use scenarios, and analyze expected behavior versus reality. So these are some perfect KPI developing steps. There is some detail of data collection and analysis and display in little detail, like the purpose or rationale of KPI should be very clearly defined. What we want to do and what is the purpose of KPI, that should be very defined. Data calculation formula, for example, numerator or denominator. Definitely, if we are collecting some data and we want to measure that data, it is very necessary to have a data calculation formula, that what would be a numerator or what should be a denominator, and how the percentage will be calculated. So it should be defined at the start of the KPI, so that the process is very smooth. Data collection type, we should identify that what type of data we are collecting. For example, if we are collecting retrospective data, if we are collecting prospective data, or if it's a process measure or input measure, output measure. So this data collection type should be very clear. Data source should be clear, from where we are getting the data. For example, if we are in some process, if we are getting some manual data, or if we are getting some system based or EMR based report in the system, so it should be clear that what would be our data source, and data source should be authentic and it should be very precise, so that the data we are getting from our data source should be very authentic. Next one is the graphical visualization and frequency of reporting. It should be defined that how we are reporting the data and upon which frequency we are reporting the data. If we have not defined any frequency, then I think there are no means of defining KPIs. If we are report data should be reported on a regular basis, so that the progress of KPI should be monitored on timely basis. There should be a graphical visualization. Graphical visualization is, I think, very important in a data presentation, because graphical visualization is important because what we are doing in our department, for example, if we are in pharmacy department, we are doing work in a pharmacy department, then we know our work practices, we know our technical things in our department. But if we are presenting data on some other forums, then it might be that those professionals whom which we are reporting or presenting our data are not much technical about this data. So it would be very clear for them to understand the data. For example, in the attached figure, we can say that if this is a January, February, and March is a data of quarter. So it should be in a bar chart form. For example, January it was 94%, and February is 93%, and in March it's 94%. It's very clear to understand that what is where we are standing and how our progress is going. We can show it in a pie chart form. uh, Next is the improvement type. How we are improving our process. What is the benchmarking? What is our benchmark? What we are aiming to achieve? We are in currently at 40%. For example, we are at 40% and we want to achieve a 90%. Then what is our benchmark? There should be a strict benchmark which we are following or which we are aiming towards, because we cannot set those targets which are not achievable. It's we have studied that it's the KPI should be SMART. The A stands for attainable or achievable. So benchmarking, setting benchmark facilitates in improving in setting the target and relevant target, so that we can attain on the timely manner. Next one is data analysis and presentation method, and final one is action plan. Action plan is the final way. It means that if we are achieving it and if we are not achieving it, then how would we move forward in our process. For example, if we are at 40% on the baseline, and after implementation of a KPI, after 6 months, we see that we are touching 70%. So it means that there is a improvement, is a remarkable improvement in our process. So at that time, we can plan for future action, that how will we take this. If we are maintaining this KPI, or we will take this to for the 90%, or we will have some modifications in our process. So our action plan would define that how we will move in the future regarding this KPI. This is some example of example of a key performance indicator, which is particularly or exclusively related to core function of pharmacy department. For example, dispensing TAT in inpatient pharmacy. Means if we are delivering dispensing medication to patients, there should be a clearly defined time frame. We cannot assume that we can dispense medicine as early as possible. We have to define that the meaning of that early, what we call the early. If we call that early means 1 hour, early means 45 hours, early means 30 minutes. It all depends upon our system, our practices, our patient load, our pharmacy department expansion. So we have to define in our pharmacy setting that what we will define as a TAT of medication dispensing. The rationale, it should be increasing complaints related to delays. Goal or target? What should be our goal and target? Dispense within 1 hour of getting order. Yes, this is very clear that stakeholder agreement, and it is clear that we want to achieve a target of dispensing inpatient medications to patient in within 1 hour. How we will measure the data, or what would be the calculation formula in this case? Numerator, number of orders dispensed greater than 60 minutes, or denominator, total number of orders. For example, their total number of orders are 1000 orders we have dispensed in a defined time, and in a time frame, and the orders we have dispensed in greater than 60 minutes, within 60 minutes. So for example, these orders are 800 orders are dispensed within 60 minutes, so we can calculate that 800 divided by 1000. It's a clear mathematical formula that it will give us a percentage that 80% of our orders are dispensed within defined time frame. Percentage of delay in dispensing, it provides the percentage of delay in dispensing, definitely. And frequency, monthly data collection, data should be collected on a monthly basis. We have defined the frequency. Source, HIMSS or manual review. Definitely a data is can be extracted from the hospital management information system report, and on this report we can have a manual review or analysis by which we can uh, formulate our data results. Sample size, all orders or X percentage of total orders. We can define the sample size on the basis of the ease of our pharmacy practice, or there should be a sample size which is some defined sample size in some cases. If we are having a HIMSS based report, HMIS based report, we can include 100% orders. And if we are doing some manual, so we can have some limited number or limited sample upon which we are doing our process. Improvement plan, monthly review in pharmacy management meeting. So we are monthly review in pharmacy management meeting. It would have an improvement plan on regular basis, so that the corrective action or corrective action could be taken and implemented on a regular basis, so that the improvement or some key changes can be incorporated in this KPI on timely basis. These are some examples of key performance indicators from pharmacy department, like prescription intervention rate. Intervention is basically the prescription is a result of prescription review. For example, when patient pharmacist is reviewing prescription, and upon appropriateness review, pharmacist finds some ambiguity or some confusion or some error in the pharmacy, in the medication order. It discusses he or she discusses it with the concerned prescriber, and logged it as an intervention. So what is the intervention rate? Number of dispensing errors, dispensing turnaround time. It could be a stat of our orders and routine orders, IV admixture wastage, and percentage of medication reconciliation done, medication storage monitoring, percentage compliance. So these are some example of common key performance indicators, or some baseline key performance indicators, that these key performance indicators shows the performance of pharmacy department. So these are some common challenges while we are implementing KPIs. Rationale and utility of KPIs. Look at the first rationale and utility of KPIs. Activities proven to improve outcomes. The barrier and challenges is time required to document KPIs, and the proposed solution is automate data collection where possible. Yes, because in some busy scenarios, it's difficult for staff to document data or log data on timely manner, so we can lose some data, and so it is very easy if we can automate our data collection process where possible. It would enhance the efficiency of our data, like for example, setting benchmarks. It is very difficult for so for to setting benchmarks, to some barriers in and challenges in setting benchmarks. Effective change management to implement and sustain KPIs with everyday practice. And the proposed solution is change management strategies. We should implement change management strategies in our department so that it is very uh, easy for a department and staff to implement changes, and there should be a change management, or there should be a culture of a change in the department so that staff can easily um, improve their cells, or improve the processes. Performance management can be viewed by trend analysis and proposal set benchmarks through comparison between clinical wards, hospitals, and health regions. Be cautious in analyzing trend. Trend analysis is a bit tricky job. So we should be very precise, or very clear, or very, we should have a clear understanding on trend analysis. Then which type of data would be uh, uh, monitored on which trends. Let's have a look of a case study. These are the case studies, our case studies, that how we improved our processes. This is the problem. What is the problem? Reported by patients and physicians that the dispensing information directions printed on pharmacy label in outpatient setting does not always match with that of reception. इसका मतलब ये है कि जब डॉक्टर प्रिस्क्राइब करते हैं तो उनकी प्रिस्क्रिप्शन के ऊपर कुछ इंफॉर्मेशन दी जाती है कि पेशेंट ने दिस मेडिसिन वुड बी टेकन बाय द पेशेंट, एंड इसकी ये फ्रीक्वेंसी होगी, इस टाइम पे लेना है, इसकी ये यूज़ की डायरेक्शन, कुछ स्पेसिफिक डायरेक्शंस होती हैं। तो जो डायरेक्शंस प्रिस्क्रिप्शंस पे होनी चाहिए होंगी, एग्जैक्टली सेम वुड बी copied or replicated on the printed label on by the pharmacy department, which they are pasting on the medications that are being dispensed. So there should not be any discrepancy or any difference among those directions. It would reduce the patient confusion and improve the patient compliance with the treatment strategy. Implication: wrong dose. Yes, patient after by confusing the instructions, patient can take a wrong dose, wrong route, duration errors may occur, or it would definitely lead to ultimately patient harm. To confirm the problem, baseline data was collected. Yes, it was reported by patient and physicians, and to confirm this, we have collected the baseline data. So by reviewing labels in comparison with prescription, results showed that 56% label information matched with the prescription. So there was a big gap. Almost 44% prescriptions were not according to the prescription. 44% labels are not according to the prescription. So we have identified that this is a genuine problem. इसके लिए फिर एक्शंस जो हमने लिए, ड्यू टू लो बेसलाइन कंप्लायंस, इट वाज डिसाइडेड टू मेक अ केपीआई टू ट्रैक द इम्प्रूवमेंट, बिकॉज इट्स अ जेन्युइन प्रॉब्लम एंड इट्स अ की issue for patient, and it's a medication safety issue and patient safety issue, so it's very important to cater this problem. KPI के तौर पे इसको डिफाइन किया गया, एडेड इन डिपार्टमेंटल KPI लिस्ट एंड वाज मॉनिटर्ड ऑन मंथली बेसिस। इसको मॉनिटर किया गया, इसके लिए जो सारी चीज़ें या जो सारे इंडिकेटर्स रिक्वायर्ड हैं एक केपीआई के लिए, वो सब इसमें इनकॉर्पोरेट किए गए, डिपार्टमेंटल केपीआई लिस्ट में इसको ऐड किया गया और इसको मंथली बेसिस पे मॉनिटर किया गया। फार्मेसी स्टाफ वाज एजुकेटेड एंड ट्रेन्ड ऑन दिस प्रॉब्लम। डेफिनेटली प्रॉब्लम है, और कभी भी स्टाफ की एजुकेशन, स्टाफ की ट्रेनिंग और स्टाफ की सपोर्ट के बगैर वो चीज़ें, या स्टाफ की जो ओनरशिप है उसके बगैर ये चीज़ें पॉसिबल नहीं होती हैं। इसलिए स्टाफ को इन्वॉल्व करके उनकी एजुकेशन ट्रेनिंग को किया गया, इंश्योर किया गया। डिवाइडेड इन टू कैटेगरीज। जाहिर है कुछ सिस्टम बेस्ड एरर्स भी होते हैं, कुछ एरर्स डन बाय स्टाफ। एरर्स, सिस्टम बेस्ड एरर्स के एग्जांपल ऐसे है कि इफ सम ड्रग ए इज बीइंग डिस्पेंस्ड ऑन TDS basis, or it should be a BD basis, twice daily basis. सो सिस्टम में TDS और BD तो मार्क है, लेकिन अगर किसी डॉक्टर ने उसको OD बेसिस पे या फिर वंस वीकली बेसिस पे या किसी और ऐसी फ्रीक्वेंसी के ऊपर प्रेस्क्राइब किया जो कि सिस्टम में डिफाइंड नहीं थी, so system will never pick that frequency by its own, or it would not give any option to select that frequency. So ऐसा होगा कि वो फार्मासिस्ट को वो फ्रीक्वेंसी सेट करनी पड़ेगी एग्जैक्टली जो सिस्टम में आ रही है उसके मुताबिक ही देना पड़ेगा। सो इन दैट केस जो सिस्टम बेस्ड एरर्स हैं उनको सिस्टमेटिकली ही करेक्ट किया जाता है, और जो एरर डन बाय स्टाफ है उनको स्टाफ की ट्रेनिंग और स्टाफ की एजुकेशन से उनको बेहतर बनाया जाता है। सो सिस्टम बेस्ड एरर और स्टाफ बेस्ड एरर दोनों को अपनी साइड पे इम्प्रूव किया जाता है। सिस्टम बेस्ड पर रेक्टिफाइड देयर एंड देन while staff was continuously guided on others। ज़ाहिर है सिस्टम बेस है तो सिस्टम में जो चीज़ एब्सेंट है उसको फॉरेन सिस्टम के अंदर इनकॉर्पोरेट कर दिया जाता है। तो उसमें ये होता है कि जब नेक्स्ट टाइम वो चीज़ आएगी तो सिस्टम में जो डिजायर्ड फ्रीक्वेंसी रूट या फिर कोई और इंडिकेशन है तो वो सिस्टम में अवेलेबल होगी एंड इट वुड बी easy for pharmacists to pick that one। After continuous monitoring and training, the compliance increased from 56% to 92% in 6 months' time। It was a very good improvement and जो हमने बात पहले स्लाइड्स में देखा कि केपीआईज को गुड केपीआई बनाने में और केपीआई को अच्छी इम्प्लीमेंटेशन करने में जिन स्टेप्स का रोल है उन स्टेप्स को इम्प्लीमेंट करने से ये फायदा हुआ कि हमने 6 मंथ में 56 से 92% पे इम्प्रूवमेंट को लेके गए। सो दिस इज अ केस स्टडी ऑफ इम्प्रूवमेंट इन फार्मेसी प्रैक्टिस बाय यूजिंग की परफॉर्मेंस इंडिकेटर। This is case study number 2. The problem is patients and nursing staff complained that there is a delay in dispensing of chemo medications to admitted patients. Implication definitely delay in treatment and patient dissatisfaction. Action taken was it was identified that no target TAT for chemo order exists. Hence, nursing staff patient expectations is different each time. जैसे पहले बात हुई है कि अगर हम कोई टाइम सेट नहीं करेंगे तो वी हैव टू डिफाइन व्हाट इज आवर अर्ली दैट समटाइम्स हम कहते हैं कि मेडिसिन को एज अर्ली एज पॉसिबल जाना चाहिए, तो हमें अपना अर्ली डिफाइन करना है कि हम किसको अर्ली कहते हैं। तो इस केस में हमने डिफाइंड टाइम फ्रेम नहीं था, तो 1 घंटा 1.5 घंटा 2 घंटा, तो हर स्टाफ की डिफरेंट एक्सपेक्टेशन है। किसी को लगता है कि 2 घंटे है तो लेट है, someone think that अगर 1 घंटा है तो लेट है, तो it was different scenario। A baseline data was collected and found that 2 hours is an adequate time period to review, prepare, pack and dispense chemo orders by pharmacy। So 2 hours were defined as a chemo dispensing turnaround time। Nursing and patients were informed, added in the list of departmental KPIs list and staff was comprehensively trained on it। इसके लिए फिर हमने एक शीट भी मेंटेन की, इसको हमने रिकॉर्ड द मेडिकेशन रिसीविंग टाइम बाय नर्सिंग स्टाफ, सो दैट कि हम उस पूरे टाइम को कैप कर सकें, किस वक्त ऑर्डर रिसीव किया, किस वक्त हमारी मेडिकेशन प्रिपेयर हुई और उसको कितने बजे रिसीव किया गया। तो हमने ऑर्डर ऑर्डर से लेकर रिसीविंग के टाइम को कैप किया, तो उसको मॉनिटर करना शुरू किया। रीजंस ऑफ डिले वर आल्सो मॉनिटर्ड ऑन शीट। उसमें एक शीट में एक ऐसा भी ऑप्शन दिया गया जिसमें स्टाफ कैन हाईलाइट और स्टाफ कैन डॉक्यूमेंट द रीजंस ऑफ डिले। After continuous monitoring and training, the compliance increased and number of dispensing delay incidents was significantly reduced. So another example of improving pharmacy practice or pharmacy process by implementation of KPIs. These are the references of presentation. And thank you for your attentions. And you are free to ask any questions if you have any questions.
Thank you, sir, for your wonderful lecture, and we got a lot of appreciation from the audience as well. So, if audience, if you have any question, you can ask the question in the question answer box. I hope so that things are very much clear for people, for the audience. Okay, again, Dr. Nabeel, thank you for your beautifully organized lecture. And all the audience are requested that you will automatically, an email will be sent about the feedback form. You will fill the feedback form and you will get the certificates in 2 weeks. So I think so. We are done with today's lecture, and we are closing it off now. Thank you. Allah Hafiz.
Thank you very much.